All right, our last lecture for chapter 1 is on medical imaging. So we're going to talk a little bit about 5 different types of medical imaging, what each of them can be used for. We're not going to go into a whole lot of detail about medical imaging in this class, but I do want to touch on it a little bit so that everybody has a general idea of what types of imaging are out there. All right, so we have, again, 5 different types of imaging: X-rays, CT scans, MRIs, PET scans, and ultrasonography or ultrasounds. So X-rays are one of the more well-known types of medical imaging. This is high-energy electromagnetic radiation. It has really short wavelength, which means it's capable of penetrating solid structures and ionizing gases. We use it mostly for the solids in the medical field. Basically, this is the best way to visualize harder body structures like teeth and bones, as we're all aware of. You think you might have a broken bone, you go get an X-ray, because X-rays are going to show these solid structures really, really well. Soft tissues will show up to an extent on X-rays. They usually show up as kind of a gray area, so you can see in this hand over here, you can see the outline of where all of the soft tissue, like muscles, would be in the hand, but this harder tissue, that bone, shows up as kind of a white shadow in this particular case, and so we can clearly see all of the different bones of the hand in these X-rays. The downside to this is that X-ray is capable of damaging cells that can trigger changes that lead to cancer, and so too many X-rays over the course of somebody's life can increase the risk of cancer quite a bit. That's why X-ray technicians and stuff will wear those lead-lined vests and things so that they reduce how many X-rays they're getting, because if your job is to take a lot of X-rays, you are going to be exposed to this radiation very, very frequently, and that, again, is going to potentially increase your risk of cancer. And so those lead-lined vests, lead is going to block that radiation. That's going to reduce how much of that radiation those people are exposed to, and why even if you're getting an X-ray, they will very frequently cover other areas of the body in lead to help protect as much as they possibly can from that radiation. Next is CT scans. CT stands for computed tomography. Tomography refers to imaging using sections. And so basically, computers will gather a bunch of cross-sectional X-rays, usually taken in the planes that I talked about in the previous lecture, and these can reveal very minute, very small details about structures within the body. This is very, very accurate. Doctors can actually measure masses down to about 1 millimeter small. So that's very, very tiny. So this is a really great, very detailed method of having scans done. Very, very useful for soft tissues versus traditional X-rays, which again are mostly for harder tissues. CT scans are used more for soft tissues, especially like the brain, and then the visceral areas in the thoracic and abdominal portions of the body. The big downside is that this is very, very high doses of radiation, even in comparison to standard X-rays, because we're taking a lot of different X-rays in a lot of different cross-sections so that we can kind of see all of these different little layers of structures like the brain. So there's a lot more radiation exposure from this. So CT scans really need to be limited to only be used when they're absolutely really needed, because of that level of radiation that's being given to that patient. And then we've got MRIs. I think most people are probably at least vaguely familiar with MRIs. This stands for magnetic resonance imaging. And so this is based on the principle that matter, so things that have mass, can be exposed to magnetic fields and radio waves, and that matter is then going to emit radio signals in response to that magnetic exposure. And so this was discovered in actually an entirely different area of study within chemistry and physics, and it was a medical professional that thought, hey, what if we could use this in medical research and the medical field in general to get images inside of people's bodies without exposing them to radiation, because this is a radiation-free method of scanning. The downsides are that it is very expensive because these are highly specialized machines, and another big downside is that this can actually be very uncomfortable for patients. Because of the way it is set up, you are enclosed in a tube. They've got more open MRIs now, as you're seeing in this picture, where only part of the body that is actually being scanned is going to be in that tube where the magnets are circling around. So that helps reduce a lot of claustrophobia a little bit. But still, if you're getting an MRI of the brain or something else in the head area, you are still going to have your head in that tube, and a lot of people can get very claustrophobic in there, even if they're not otherwise claustrophobic. I've had a couple different MRIs on my head, and I'm not generally a claustrophobic person, but just that first minute or so of being moved into that tube, it's a very small tube, there's not space to move around, you're also not supposed to move around at all. It's kind of disconcerting, and it can be a little panic-inducing at first, so you kind of have to breathe through it a little bit, and some people just straight up cannot be in an enclosed space like that without heavy sedatives, which is an option in a lot of cases, but sometimes people just can't have MRIs at all. The other slight downside is that if the patient has any sort of metal implants, like joint replacements or heart monitors, stuff like that, they cannot be in the MRI machine because these are very, very strong magnets being used, and that can cause a lot of issues with the implants. It can cause them to move and stuff like that, if not pulling them out of the body completely, depending on where the implants are located. So it's very, very dangerous for patients with implants to undergo MRI procedures. PET scans. PET stands for positron emission tomography. So this method uses something called radiopharmaceuticals. These are substances in the pharmaceutical industry, so the medical drug industry, that are going to emit some radiation that's very, very short-lived, and is therefore relatively safe to give to patients because it is going to be very short-lived radiation, so there's less of a chance of long-term cell damage happening from this radiation versus x-rays and CT scans. So these are relatively safe, but radiation is still radiation, so frequent exposure to that can still cause some issues. And one of the biggest advantages to PET scans is that they can actually show physiological activity. So these can show things like blood movement and stuff like that, instead of just showing still images of different areas of the body. This can actually show things in action moving through the body, which is really, really cool. And last but not least are ultrasounds. This is also referred to as ultrasonography. So this uses high frequency sound waves that are transmitted into the body, and then what's being read back is kind of an echo signal. So as those sound waves bounce off of different structures, they are going to produce this kind of echo signal that is converted by a computer into a real-time image of anatomy and physiology. So ultrasounds, I think most people are relatively familiar with, and so you can actually see things moving as you're using an ultrasound. This is the least invasive of all of the different imaging techniques. Some of you maybe have had an ultrasound before. I have. Pretty low key. Nothing too crazy about it. But the big downside to ultrasounds is that the image quality is very operator dependent. So if you don't have a skilled ultrasound operator, that can cause a lot of issues with what's being read. As you can see in the images here on the right hand side of the screen, to an untrained eye, it just kind of looks like a bunch of black and white nonsense, right? And so it takes a lot of skill and experience to be able to accurately read ultrasounds. And then ultrasounds are also not able to penetrate bone and gas, so this is exclusively used for soft tissues. There's some different uses for this. The most common one that most people are familiar with is to do scans during pregnancy, but it can be used for other things like finding kidney stones, as well as finding other reproductive system disorders like uterine fibroids and ovarian cysts and stuff. But again, you need to have somebody who is skilled and very trained to identify those kinds of structures to be performing these ultrasounds. And that wraps up all of our lectures for Chapter 1.